The Ministry of Labor's proactive inspection blitzes are designed to raise awareness of these hazards and to improve compliance with health and safety legislation. So the blitz topics are announced in advance on our website, and the results of the blitzes are posted afterwards. So we want to track the results of the blitzes in terms of increased compliance with the legislation and improvements to injury rates through reduction of these hazards. For the musculoskeletal disorder blitz in the healthcare sector, Ministry of Labor inspectors will be in healthcare workplaces actively inspecting for MSD hazards. So we want to ensure that workplaces are protecting the workers from these hazards and that they're complying with the occupational health and safety legislation. So the Ministry of Labor will take an active enforcement role in the blitz to ensure that workers are protected. Musculoskeletal disorders include sprains, strains, soft tissue injuries, and back injuries. These are the main causes of workplace injuries in Ontario workplaces. In the healthcare sector, musculoskeletal disorder injuries account for about 46% of the lost time injuries. That's over 55,000 lost workdays from these injuries, and over $8 million in WSIB and medical costs. Plus, we also have to consider the personal impact of these injuries on workers and their families. So that's why it's important for workplace parties to evaluate these hazards, look at the measures and procedures that are in place to protect workers, and comply with the health and safety legislation in Ontario. There are a number of different activities that can result in workers obtaining a musculoskeletal disorder or an MSD. In this particular blitz, we're going to be focusing on client handling techniques and manual materials handling. Now, client handling, we're talking about client or patient lifting, transferring, or repositioning, whether by manual methods or with specific equipment. And we'll be looking for ensuring that workers are trained in these techniques. They're trained in using the equipment properly, and that the equipment, if they're using equipment, is properly maintained. Manual materials handling tasks have a strong relationship to lower back injuries and shoulder injuries. And objects in the workplace must be safely lifted or lowered and pushed or pulled. And any equipment used for manual materials handling must be properly maintained. So inspectors will be focusing their inspection activities on long-term care homes, community health care, and retirement homes. The most effective MSD program is a prevention program, and our goal is to assist healthcare workplaces in preventing these injuries. When inspectors arrive at a workplace for the blitz, the first thing they do is an administrative review. They sit down with the Joint Health and Safety Committee, with the management and worker health and safety reps, and discuss with them the purpose of the visit, what they're looking at, the purpose of the blitz. They'll review with the workplace parties, the Joint Health and Safety Committee, the measures and procedures that are in place now for prevention of musculoskeletal disorders, what musculoskeletal disorders and injuries have taken place already, and what they're doing to prevent those injuries and train workers and keep workers safe in the workplace. After the administrative review, the inspectors will perform a physical inspection of the workplace together with the health and safety representatives. They'll go into the workplace, they'll look for the potential sources of hazards from client handling or manual materials handling. They'll speak to workers, they'll ask them about their training, if they know how to properly lift or transfer patients, how to use equipment properly for manual materials handling. They'll inspect equipment records for patient lifts or for manual materials equipment and look at their condition of the equipment. For manual materials handling, inspectors will look at how objects are stored, how they're moved, what type of equipment is used, the maintenance of the equipment, the training of the workers, and any hazards that are associated with moving equipment. In healthcare facilities, we're going to be looking at carts also, how the carts are maintained, how workers are trained in moving carts around. That's a very significant hazard in healthcare facilities. To prepare for an inspection for this MSD Blitz, so healthcare workplaces should be identifying and controlling MSD hazards in the workplace. There can be consultation with the Joint Health and Safety Committee on these hazards to help identify the particular hazards and the potential methods for controlling these hazards. Workplaces can also obtain external assistance for identifying and controlling these hazards, such as from consultants with the Public Services Health and Safety Association. The workplaces should be ensuring that there are measures and procedures in place for controlling these hazards, and there's education and training programs in place for workers. When Ministry of Labor inspectors perform the Blitz visit or the Blitz inspection, these are done unannounced. So while we announce the Blitz topics in advance and provide information on the hazard and hazard control and advice on compliance with occupational health and safety legislation, the particular inspection visits for each workplace is not announced. In order to assist workplaces in improving occupational health and safety in their workplace and protecting workers, our Ministry of Labor inspectors will be providing resources to the workplace parties to enable them to protect workers from MSD hazards by identifying, controlling, and training workers on these hazards. So a number of resources are available, and we'll be identifying those and providing them to the workplace parties to assist improving occupational health and safety in the workplace. So our goal in healthcare workplaces is to ensure that we have a quality healthcare workplace so that workers are safe and workers are able to deliver quality healthcare to the people of Ontario.